How does DaTscan fit into a Parkinson's diagnosis? Have you ever wondered how doctors confirm a diagnosis of Parkinson's disease? One important tool they use is called DaTscan. This imaging technique helps visualize the brain's dopamine system, which is crucial in understanding Parkinson's disease. DaTscan, also known as dopamine transporter single photon emission computed tomography, uses a radioactive tracer that binds to dopamine transporters in the brain. In individuals with Parkinson's disease, these transporters are often reduced. Parkinson's disease is primarily diagnosed through clinical evaluation. This includes a detailed medical history and a physical examination by a neurologist. Early diagnosis can be tricky because the symptoms can resemble those of other conditions. This is where DaTscan comes into play. It can provide clarity when clinical findings are uncertain, helping to distinguish Parkinson's disease from other similar disorders, like essential tremor or drug-induced Parkinsonism. The process of getting a DaTscan is straightforward. A small amount of radioactive tracer is injected into the bloodstream. This tracer then accumulates in the brain, particularly in the striatum, where dopamine transporters are most concentrated. In a healthy brain, the uptake of this tracer is normal. However, in someone with Parkinson's disease, the uptake is typically reduced, indicating a loss of dopamine transporters. Interpreting the results of a DaTscan can be very helpful. If there is a significant reduction in dopamine transporters, it can support a diagnosis of Parkinson's disease. However, it's important to note that DaTscan is not a definitive test on its own. It should be used alongside a thorough clinical evaluation. DaTscan is especially beneficial for providing diagnostic clarity. It helps differentiate Parkinson's disease from other conditions that may mimic its symptoms. However, it does have limitations. While it can support a diagnosis, it is not a replacement for a clinical evaluation. In fact, the accuracy of a neurologist's clinical assessment is often comparable to that of DaTscan imaging, especially in later stages of the disease. In summary, DaTscan is a valuable tool in the diagnostic process for Parkinson's disease, particularly when clinical findings are ambiguous. It should be used as part of a comprehensive approach that includes clinical evaluation and other diagnostic tests as needed. If you have concerns about Parkinson's disease or related symptoms, it is always best to consult a healthcare professional for personalized advice and guidance.